Hi friends, today we are going to discuss about daily dose day 1, several topics which are very important to the competitive examinations. First one, if a patient presents with a absent HGPRT, that is hypoxanthine guanine phosphoribosyltransferase, transferase, and increased de novo purine synthesis, which is a purine salvage pathway defect. And this HGPRT defect is due to this HPRT1 gene mutation on X chromosome, which means that it is an X-linked recessive disorder. And patient also presents with the increased uric acid levels, that is gout symptoms, and pissed off behavior, which is like aggressive self mutilation. The keyword here is self mutilation and HGPRT gene defect and purine salvage defect, that is increased de novo purine synthesis and gout. What will be the diagnosis? This is nothing but Lesch-Nyhan syndrome. Lesch-Nyhan syndrome. These are all the features presenting with the Lesch-Nyhan and the keywords regarding it. First one is HGPRT, second one is purine salvage pathway defect, and it is an X-linked recessive disorder which is due to the mutation of HPRT1 gene and increased uric acid production, symptoms similar to gout, and pissed off behavior like self-mutilation, aggressive, everything. And second topic, if a patient presents with like in a given clinical scenario, it is mentioned that there is a failure of mismatch repair during S phase and defect in MLH1, MSH2, MSH6, PMS2 and EPCAM, and microsatellite instabilities, and there is an increased risk of HNPCC, hereditary non-polyposis colonic cancer, which is the most common, and increased risk of endometrial cancers and other GI cancers, ovarian cancers, etc. And this disease is an autosomal dominant. Main keyword is mismatch repair and MLH1, microsatellite. If you see any of these keywords in the question, we need to mark only one answer, that is Lynch syndrome. Most commonly associated with HNPCC, Lynch syndrome. HNPCC means hereditary non-polyposis colonic cancer, and other cancers also have, and it is an autosomal dominant and mainly EPCAM defect and MLH1, MSH2, MSH6 and PMS2, and mismatch repair occurs during which phase? It is during S phase of the cell cycle. And microsatellite instability was the we need to remember this Lynch syndrome. And third one, if a question describing about mutation at splice site or mutation at promoter sequences and retained intron in mRNA and decreased production of beta chain of globulin, globin, and the patient presented with the hemolytic phases and anemia symptoms like weakness, tiredness, etc. The question describing about the symptoms and defects of beta thalassemia. It is nothing but beta thalassemia. And beta thalassemia major shows this hemolytic phases and milder symptoms will be seen in minor cases. Beta thalassemia, main thing we need to remember, retained intron in mRNA, and mutation where it will occur is splice site or promoter sequences. This is the keywords of beta thalassemia. And beta globulin defect and decreased production. Next one, if in a case it is describing about type 1 collagen defect due to inability to form triple helices, that is main keyword is type 1 collagen defect. Why it is defect? Due to inability to form triple helices, and the patient present with the hearing loss. Why hearing loss will occur? Mainly due to inner ear and middle ear bones affected, and blue sclera, musculoskeletal pain, and multiple fractures. It is like, it looks like the child is being abused but not. Various degrees of healing, It is like child abuse, but it is a DD of child abuse. It is not a child abuse. And there are 4 types in these diseases: type 1, type 2, type 3, type 4. And type 1 and 4 are autosomal dominant, and type 2 and 3 are autosomal recessive. And you need to remember this blue sclera here, and type 1 collagen defect, inner and middle ear bones affecting, morely bone pains, bones affected, hearing loss, everything goes into the diagnosis of osteogenesis imperfecta. Osteogenesis imperfecta. See, osteogenesis imperfecta, type 1 collagen defect due to inability to form triple helices, and SNH like hearing loss, and blue sclera, musculoskeletal pain, multiple fractures. And there are 4 types: 1, 4 are autosomal dominant, and 2, 3 are autosomal recessive. Next one is, if a case describing about ATP7A protein defect and impaired copper transport and absorption, and decreased lysyl oxidase activity, and decreased collagen cross linking decreases, and most importantly it is an X linked recessive, and patient has the kinky hair. Patient will be having that kinky hair. It is kinky, like Menkes kinky disease. It is nothing but Menkes disease. Here we need to remember ATP7A protein defect, and which is the copper transport and absorption defect. Here, due to this defective copper transport and absorption, so there is a decreased copper level. So the lysyl oxidase, which is dependent on copper, is reduced. Activity of this lysyl oxidase results in decrease in collagen cross linking. It is an X-linked recessive disorder, and kinky hair will be there. So these 5 are the very important topics we need to remember: the defects and clinical features, and how this case will be presented. Thank you friends. Please subscribe for the more questions.